How's it going, YouTube? Dr. Freeman here from Freeman Chiropractic Wellness, and today we're going to go back to one of the things that I see in the clinic most often, and that's low back pain. There are a lot of things that can cause or contribute to low back pain, but we're going to be focusing on a muscle that I see contribute to the vast majority of low back pain cases that walk through my door. Before we get too far in, I do want to mention that our clinic is running a promotion right now through the end of December that's heavily discounting the first visit for new patients. If you're in the Ithaca area and you're interested in getting more hands-on help with your pain, check the description down below. We're going to leave some details. And if you book before the end of the year, even if it's for an appointment in January, this offer will still be valid. Now let's get back to the content. The muscle that we're going to be focusing on today is the quadratus lumborum, or the QL for short, which is how I'll be referring to it for the rest of the video because it's a little bit less of a mouthful. The QL runs along both sides of the lumbar spine. It originates at the posterior aspect of the iliac crest. Now, if you're not familiar with anatomy, that's okay. We're going to dive a little bit into the anatomy of this muscle because it helps us understand some other things. So the iliac crest is part of the ilium, which is a part of your pelvis. If you kind of poke into your side here and you feel a bony arch up above your hip bone, that's your iliac crest, the QL starting right in the back part of that area. So it runs up from the iliac crest, and then it connects to the transverse processes of the first four lumbar vertebra, so that's the upper part of your lumbar spine, as well as the 12th rib, your last rib. Now that's as technical as I'm going to get. We're not going to get too much further into the weeds, but understanding this is helpful because some of us are visual learners, and if you understand where a muscle runs, you can understand what happens when it shortens, and that can help us understand how to strengthen it and how to stretch it. With all of this said, the QL, when it contracts on one side of the body, is going to do one of two things. It's either going to elevate that side of the pelvis if our trunk is in a fixed position, or it's going to laterally bend our trunk toward that side of the pelvis if our pelvis is in a fixed position. If we contract both QL muscles at the same time, it's going to extend our low back, which is putting it into an arched position. All of this is going to come into play shortly when we talk about stretching this muscle, but first let's talk about why it's so important. Well, the QL is a common contributor to low back pain. It can cause pain on its own if it goes into spasm, if it forms myofascial trigger points, which we'll go into greater detail on in a later video, or if it has an injury to it directly. But there are also a lot of other important things in the vicinity of the QL. And when those things get injured, the QL, being a very large muscle, goes into what we call guarding mode. This means that it's going to contract involuntarily to try to form a protective shield around those other structures. Now, this can be appropriate for an acute injury to, let's say, a kidney, a disc, something like that. You really do want that added layer of protection. But as these other injuries heal, the QL should relax alongside them, and this doesn't always happen. These long-term involuntary contractions, or even just increase in muscle tone over time, can cause that chronic back pain that all too many of us know very well. Now, if this is what's going on for you, or even something that's just contributing to a part of your pain, then adding a simple stretch into your daily routine could work wonders for reducing your low back pain. Now, without further ado, let's jump into it. We're going to perform this stretch in a seated position. Now, normally I like to promote good posture, but this stretch may be the one instance where I'm going to instruct you to slump forward and round your low back. The reason for that is we're trying to increase the distance between our 12th rib and our upper lumbar vertebra and our pelvis. That helps us stretch the muscle. This stretch is best performed unilaterally, or one side at a time, because this allows us to add a side bend away from that side to stretch that muscle even further. So now go ahead and do it with me. What we're going to do is we're going to slump forward and take one of our elbows and rest it on our knee. The opposite hand we're going to take and reach it up by our ear, and then slump forward even further and reach forward to the opposite side diagonally. Once you get into this position, you should feel a strong pull through that QL area on the opposite side. You're going to want to hold that position, and I'm going to put a picture up on screen of me doing that now, for about 45 seconds to a minute. And this can be repeated several times throughout the day if you're having a lot of low back pain, and this does help you find that relief. Or it can just be done a minimum of, I advise, once per day. Now, if this helps you get out of pain, you're feeling great, I really advise keeping this in your daily routine. That continued stretching can really help prevent the risk of reoccurrence. Remember that as we hold this stretch, our muscle should be actively loosening through the entire 45 seconds to a minute that we're holding it. What we're trying to do is maintain that feeling of the stretch that we got at the start. So as you go, if the muscle loosens up and you start to lose that feeling of a stretch, don't be afraid to lean a little bit further in to try to maintain that same feeling the entire time. And that's your take-home tip for the day. Like I said, low back pain is a very complex issue with many causes and contributors. So if this wasn't the stretch for you, or if it only addressed part of your problem, then make sure to stay tuned for future videos where we may address your problem more fully. We've already covered low back pain related to tight hip flexors, so if you're interested in that video, we'll have it linked on screen now as well as in the description below. Feel free to check it out. We've also covered tennis elbow and golfer's elbow over the last couple of weeks. If you happen to have elbow pain, whether you're a tennis player, golfer, or neither, those videos might be worth checking out as well. Thanks so much for tuning in. I hope you have a wonderful week, a great holiday, and I'll see you next weekend.